Today, we will be discussing healthcare professions, nursing, and medical schools in Southern Nevada. Greetings, student. You have now reached your final year in high school, your senior year. You are now on your way to be a healthcare professional. You're probably already overwhelmed with all exams and college applications you have to complete this year, but don't worry, we got you covered. We created this short informational video for your convenience to help you apply to various schools in Southern Nevada. The healthcare profession is a constantly growing field. It is categorized as one of the most rewarding career fields because you get to provide your aid to the service of people. In the United States, around 12.5 million people are employed in the healthcare industry. This includes a variety of settings ranging from hospitals to offices. We included a few job descriptions of some careers in the healthcare field. Dentistry is a branch of medicine that is concerned with the study, diagnosis, prevention, and treatment of diseases, disorders, and conditions of the oral cavity, the adjacent and associated structures. Essentially, dentistry is directed at oral care and dental health maintenance. Pharmacists dispense medications, assuring the safety and appropriateness of the prescribed therapy. They also collaborate with physicians, nurses, and other members of the healthcare team to provide expertise on drug decisions and improve patient outcomes. Optometrists typically do the following: perform vision tests and analyze results, diagnose sight problems such as nearsightedness or farsightedness, and eye diseases such as glaucoma, prescribe eyeglasses, contact lenses, and other visual aids. There are many other practices and careers you can pursue, such as physical therapy, psychology and counseling, radiology, emergency medical technician, and nursing and medicine, which we will talk about in this video. Southern Nevada nursing programs. Nursing is a field that is concerned with taking care of ill or injured persons and providing preventative healthcare to well persons. Nurses work in various settings, including hospitals, long-term care facilities, public health departments, businesses, public schools, and mental health centers. In the state of Nevada, there are 15 accredited nursing programs. Programs in Southern Nevada include the UNLV School of Nursing, College of Southern Nevada, Nevada State, and Touro University. There are also many types of degrees that you can apply for depending on the level of care you want to provide. They range from certification programs to PhD programs. Some types of nurses include BSN, MSN, and DNP. Prior to applying for nursing school, you would need to take the following prerequisite courses. These challenging courses include general microbiology, general chemistry, anatomy and physiology, and general health classes. You would also need to complete an entrance exam called the Health Education Systems Incorporated, also known as the HESI. The total length of the exam is 5 hours and 15 minutes. The primary areas tested are English, math, and science. In terms of job outlook in the state of Nevada, here are a few things to consider. Nurses are ranked number 9 as the most overworked. They have the second highest annual nursing salary, and by 2024, we will be known as the least competitive state. The nursing program includes both classroom instruction and clinical practice. Students are trained to provide care, support, and education to patients, monitor the physical and mental status of patients, and record patient progress. Southern Nevada medicine programs. Physicians and surgeons diagnose and treat injuries or illnesses. Physicians examine patients, take medical histories, prescribe medications, and order, perform, and interpret diagnostic tests. They counsel patients on diet, hygiene, and preventative health care. Generally, there are two different classifications of doctors, an OD or an MD. A doctor of osteopathic medicine is centered around a more holistic view. They see the patient as a whole rather than treating the symptoms alone. A medical doctor practices allopathic medicine or classical medicine based on diagnosis and treatment of human diseases. Along with prerequisites, the MCAT or the Medical College Admission Tests are required before applying for medical school. There are two main medical schools in Southern Nevada. The University of Nevada, Las Vegas is an MD school that accepted its first class in the summer of 2017. And Touro University, it is an OD school located in Henderson, Nevada. Medical school programs have different curriculums depending on the school that you go to. Check the school's website to determine the best schools that fit your study techniques as well as your interests. In the following, we have attached a few interviews with people that have attended or are attending nursing schools. They wanted to share their experience to help prepare you for the field you are about to join.
Hi, my name is Ron, and I'm a level 1 student, and this is my first semester in nursing school.
My name is Bianca. I'm a level 1 nursing student here at UNLV.
The biggest obstacle for me was actually like the prerequisite classes, especially bio and the labs, just because they put you through so many things and you have to memorize so many things in the span of a week. But if you really put in like the work into it, it's really possible and manageable.
It's competitive, you know. The people don't even try sometimes to make it in. They just think, oh, it's so hard, so they're gonna choose another major maybe.
I wanted to do nursing because I wanted to help people firsthand, and I wanted to be with them in their bedside when they needed another person there the most, and I just wanted to be directly involved in the people's lives and be with my community.
I've always had a passion for helping people and helping them get better. And I also think in nursing you can go into so many different fields. You know, you can work with kids, you can work with hospices, you can work in hospitals. So you have so many avenues you can go into, and you're not just stuck in one. I love that.
In the future field of nursing in Nevada, I hope that it increases and grows, because of right now Nevada is actually really late on the nursing field and compared to other states. So there's actually a lot more nurses here in Nevada that leaves after 1 or 2 years working here because they can't take the workload. So I just really hope that in the future we can get our nursing straightened out, and hope that more nurses come here and actually stay here.
I hope for more jobs and like maybe more opportunities to be a nurse, you know, because like I said, some people think that if they don't make it in here at UNLV, then they should switch majors because there's no other options. So maybe more education options as well, and maybe less stricter requirements, so that people are not discouraged to join the program. And yeah, more jobs, and jobs that are not like, you know, one nurse gets 10 patients. You know, I hope for a job that you get the chance to actually give your all to all your patients.
As of right now, the most rewarding for me is going to clinicals and actually interacting with the patients there. And I've had a pretty good experience at clinicals so far, and the patients I've been really close with, even though we're there for only 6-7 hours. I've actually had a relationship with all of them, and I've gotten close to them, and it's pretty much, it's really hard leaving.
How many approved nursing programs do you think there are in Nevada?
Let's see, there's UNLV, there's CSN, there's Roseman, Nevada State, and Pima, so I'm gonna say 5.
Actually, there are 15 approved nursing programs in Nevada.
Oh, really?
How many active license holders slash certificate holders do you think there are in the nursing field in Southern Nevada today?
10,000.
Actually, no, there are 47,828 license holders that are still active.
Oh wow.